Hello everybody. In this video I would like to present two interesting studies on arterial hypertension which has important implications in our daily praxis. Here is the first study recently published in Nature Medicine. The authors investigated the effect of salt substitution on 2,376 participants which were included in this study in 6 villages in Peru. So in this study, the regular salt in enrolled households was retrieved and replaced, of course, free of charge with a combination of 75% natrium chloride and 25% potassium chloride. The first aim of this study was to investigate the role of salt substitution on blood pressure, but more important than that, the investigators wanted to see the effect of salt substitution on long-term incidence of arterial hypertension in this group of participants. This figure shows the effect of salt substitution on systolic and diastolic blood pressure. As you can see, there is a significant decrease in the systolic as well as diastolic blood pressure. And the most important thing was in this study, this reduction was irrespective of basal blood pressure. It means that they observed the same effect in patients without hypertension and also in patients with different degree of arterial hypertension. So the next question, and even more important question, that the authors wanted to address was to see the effect of salt substitution on incidence of hypertension. So this is very important among participants without hypertension at baseline. In this study, the use of salt substitution was associated with a 51% reduced risk of developing hypertension compared with the control group. And this is very important. It was not a salt reduction study, and they just replaced 25% of normal salt with potassium chloride. And the result of this important study support the case for implementing a pragmatic and population-wide salt substitution strategy for reducing blood pressure and also hypertension incidence. And as you can imagine, this simple intervention will have an important impact on cardiovascular disease burden worldwide. This is the second study. The investigators actually tried to answer a very simple but very important question. The question is, what is the optimal timing of taking antihypertensive medication? Early in the morning or at the bedtime? So in a clinical primary care setting, this study was designed to test whether bedtime in comparison to usual upon awakening hypertension therapy affects cardiovascular disease outcome in patients with arterial hypertension. In this multi-center controlled prospective endpoint trial, 19,000 hypertensive patients were enrolled and assigned to take the entire daily medications either at bedtime or all of them upon awakening. And this is the Kaplan-Meier curve of cardiovascular outcome and also cardiovascular events during long-term follow-up in this study, which shows a significant decrease in cardiovascular disease events and also a significant improvement in outcome in the group of patients who took the medication at the bedtime. Here is the subgroup analysis of this study, which shows the consistent improvement in different parameters in patients who took the medication at bedtime. We can see here that not only the total mortality and cardiovascular mortality was decreased in these patients, but also ischemic stroke, hemorrhagic stroke, myocardial infarction, revascularization, and heart failure was decreased in these patients who took the medication at the bedtime. So it seems that taking the medication at bedtime can decrease significantly the number of cardiovascular events, and also can improve the cardiovascular outcome during the long-term follow-up. So this was a short review of two recent important studies on arterial hypertension. I would like to thank you for watching this video, and I hope that you join me on my website for the coming videos and presentation. Thank you and bye.